What we're going to do for today is, rather than using a presentation, we're going to do a sort of live application session focusing on maximizing your use of the MUSE web client. I'm using a demo system today, so all the patient data that you see is fictitious, and most of the ECGs, for people that are very familiar with ECGs, won't look very realistic because they all come from patient simulators, so they're all electronically simulated. Before we jump into the main part of the training session, I thought it would be quite nice to sort of touch on how we access the MUSE web client. So people that are familiar with MUSE, you might be familiar with the MUSE editor client or the MUSE thick client, which is a desktop-based application. And you might be familiar with the MUSE web, or if you're not a sort of more current MUSE user, maybe you're using MUSE version 9 or earlier, it might be called CV web. So that could be a name that you're more familiar with. If you are using an older version of MUSE, then this is going to have a lovely facelift, so it's a nice opportunity for you to see that. And for people that are on NX onwards, it's hopefully going to give you some tips and tricks to take away and help with your usage of this in clinical practice, or give you a few ideas of different ways you can use the MUSE web client at the same time. So accessing MUSE is based on Active Directory login. So generally, when I'm looking at the sites that I work with in the UK and Ireland, the majority of the hospital staff are on a sort of view-only access, because we don't want everybody to be able to edit the ECGs and clinically confirm them within the web client. Then we'll have a smaller group of people that are able to sign the ECGs and have a sort of super user or editor access. And then we'll also have a group of people that are sort of overseeing the whole MUSE system and on a super user access as well. The MUSE web client has an unlimited number of licenses associated with it, and you can access it from anywhere on your hospital network, even remotely if you're dialing in via a VPN, perhaps using an iPad at home to look at an urgent ECG, maybe if you're on call or something. Accessing the web client can be done in a number of different ways. You might have a link in your intranet page. You might have a sort of shortcut on your desktop. I've got this here. I'd say for most of my customers, it kind of looks like the GE circle icon that I'm hovering over here. Some sites do have it as their blue icon, and it's a little bit variable. Or you might have it as a contextualized link in your hospital electronic patient record. So I've simulated that down here with a patient that I've pulled into my electronic patient record, where I've got a PDF pushed in and also a contextualized link that will automatically launch the MUSE web client for me here. Now, this is where I will log in. And when we're using the Active Directory, that means we link to our hospital sort of Windows logon password. So there isn't an extra one to remember. It's also quite nice to touch on if you're finding you are getting a number of tests locked out. We do have an auto log out function on here, and that's set at the time of implementation. But you can always look to sort of see, can we reduce that if you're finding that's something that you want to change. We can then sign in down at the bottom, and this is going to bring me up to my default screen. And I thought it was really nice in Adam's presentation that he had a screen grab of how their home screen looks in the MUSE web client, and we could see the editor name, the heart rate, and the QTC interval on there as well. And when mine loads, you'll see it actually looks quite different. So it's quite a nice way to visualize the different options that we have built into the MUSE web client, and how it can really be tailored to your hospital site and how you want to use it. So when this loads, we will have a number of options along the top. And what we'll do is we'll sort of have a little look through the different bars and viewing options we have here. Now, mine is set up to sort of try and cover as much as I can, because this is my training system, and I use it for different ways that we can use the system. So the first tab that I've got on here is my in basket, and this is where I am pretending to be the clinician. You can see I've got my login name on the top right here, and any test that's been assigned to me for review is going to come up in my in basket here. We also have all unconfirmed ECGs, so any ECG that's been taken that links to the sites I read from will be in my unconfirmed ECGs. And this might take a little bit longer to load than my own in basket because of the volume of data that I've got in here. I then have my recent edits, and then having a look over at this side, if we're looking at perhaps a virtual ward program or mobile ECGs, this is where I'm going to be pulling in my cardiomobile 6-lead ECGs to be reviewed as well. I've also segmented mine into exercise tolerance tests, Holter, and my critical ECGs. So this is something that's coming from the cart. If it's labeled as a critical ECG using our 12SL automated interpretation, we can pull that in and have a segment labeled as my critical ECGs on here. Just to cover everything, I've also sorted based on location as well. So perhaps if you're in the ED department and you're wanting to go to someone to analyze all your ED ECGs, you may have a tab that sorts on your location, and then you can analyze those in there as well. Of course, we can also search along the top. So MUSE itself is very patient ID centric. So I'm always going to search by my patient ID, and this will pull up anybody that corresponds to this patient ID number. Along here, you can see we have my patient ID, last name, first name, date of birth, and I'm also sorting in time and date order. So usually I would have mine defaulting to my most recent first. We have our test type, and here I've got ECG, mobile ECG, and Holter recordings, but we can bring in alternative test types as well. And I also have my test status, which I'm going to touch on in a moment, and whether or not we have a mismatch. We have the option to sort these in different orders, so I can sort by grouping all my test types together in date and time, and I can also click and drag my columns if I want to change the order of that. They'll all set to a sort of default column order, which is dependent on a global setting for these profiles. But if your preference is to view in a certain way, you can just move it if you're batch analyzing a number of ECGs. Before we dive into looking at an individual ECGs or sequence of ECGs, it's really important when we're analyzing data that we're analyzing good quality patient information. So you can see here we have a number of different options under status. I've got newly acquired, demographics complete, and confirmed. And all of these things mean different things with our ECGs. So newly acquired means the ECG has come into the system, and when it's landed in MUSE, MUSE has done a check of the patient ID, the patient name, and the patient's date of birth. And at some point, it thinks there's a mismatch with what's been confirmed previously in MUSE and come in from the hospital information system. So if I was to open this test, I would have a large red bar along the top of the ECG, and I'd have a mismatch icon indicating that the system doesn't think this patient demographic data is correct. And it really draws my attention to it to think, okay, I need to really double check this and make sure I'm happy. You can also see along the top here, I don't have any patient information, so it makes sense as to why I'm seeing that. In this instance, I would not be able to clinically confirm this ECG, although I could look at it and do the analysis and save it as diagnosis complete to be reviewed later and have their demographics completed or confirmation accepted. If I go back to my home screen, the next one we'll have a look at is demographics complete. Now, when this comes into the system, what we're going to get is a blue bar along the top, and we'll be able to see our patient demographics. And we know that we can be fairly confident that all of this is what we're expecting to see. The other option we got under our test status is confirmed. And this is indicating that we've had a clinical review and someone has clinically signed this ECG. There are a number of other options, such as updated and diagnosis complete. These are the three that I tend to see most frequently with the sites that I work with. If you would like a much more comprehensive overview, and this is also contained within the manual, which a sort of short version of the manual can be accessed by going to your name, clicking the down arrow and going to help. Now, I'm going to search for one of my patient tests. So I'm typing my patient ID in the top here, and I'm going to open up my patient test. Now I can see that I'm sorting in date and time order, and I've got a couple of different options of my test status on the side here. I've got my test status as demographics complete, and I've also got confirmed. So if I open up one of my ECGs here, anything that I open from my current one in the list is going to have a pink grid line background, and this indicates to me it's the one I've selected from my drop-down list. The first place my eyes are going to go to when I'm looking at this is going to be the blue bar along the top, so I can feel confident I've got the correct patient demographics. I can also click on my drop-down arrow to see more information that's coming into the ECG from my ECG machine and from my order, or any extra information that's been associated with that test. You can say I have my patient's height and weight. If I had order numbers or order details, that would be in here. Within the web client, you're also able to attach or detach an order on here. But this is the only editing of patient demographics that we can do in the web client. For everything else, that would be done in the editor client for changing patient names and stuff like that. Over to the side, I also have my test details. And along the side here, where you see we have these 4 areas, this is for extra questions of data that you can input on your GE Healthcare ECG machine at this point of taking the test. We also have my test editor if it's been confirmed, and any referring physician details as well. Below this, we have our automated interval measurements that have come in from the cart. These are editable with the correct permissions within MUSE, and I'll come on to this shortly. And we also have our automated interpretation, again, that's come over from our 12SL automated interpretation from the cart. Now, at this point, we do have the option to analyze our ECG and change our interpretation as well. If you're frequently changing stuff, or maybe you want to have it on there for people to review the information when they take the ECG, but you're going to do a total sort of overhaul of your interpretation, one of my tips and tricks for making it a little bit quicker is we can press Control and A. This will highlight everything in your box, and if you want to, you can delete it and start free typing. Now, if you do that by accident, you can always restore your original diagnosis as well, and this will give you a comparison to the original and what you've got currently in there as well. If you want to just change part of what's come over from the cart, we can right-click and convert this to free text as well. When it says free text, you can see it has a blue background as opposed to a black text with a grey highlight. So it really guides me to where this information is coming from. So as we've seen, we do have the option for free text. However, my preference is generally to use our automated drop-down menus, because these are going to be number coded in the background. And if we're pulling out information with database searches, these are all coded to extract that data with. Similarly, if you're going to be doing research procedures, you may want to add them in, because in the editor client of MUSE, you can also add extra statements. So I've added study and then made up a reference number here, and then I can number code search this in my database searches to pull out at a different time. Equally, if you're looking at AI ECG, maybe we want to label that this ECG is going to be extracted for an AI research study. You have the option to sign the ECG as well. And if we click sign, this will then move me onto my next ECG for review. It will also leave a green tick, and any previous ECGs that have been clinically confirmed will have a green tick on here as well. Along the bottom here, we have our sweep speed, which we can set to 50 or 12.5 away from our standard default of 25 millimeters per second. We're also able to change our amplitude settings either just on limb leads or precordial, or as a global change. And we can apply a filter retrospectively if we wish. We also have the option to change how we're viewing our ECG on here, and we can change it to 4.5 by 1, 4.5 seconds, 4 by 2.5 seconds, adding rhythm strips, or one that I really like is being able to view in 12 channels of rhythm. Now, along the side, we have our serial presentation, and we also have our previous ECGs. So if I want to have a look at my first previous, we can see that here I had a patient in an AV block, and happily, now my current ECG, the patient has a pacemaker. We can have a look at any previous ECG. So I know when I was in clinical practice, I might have taken an ECG, but perhaps the patient was a little bit tense. So after they've relaxed a little bit, then we can see that one. Now that's great, but maybe I don't want to compare one ECG from now to one that came in sort of 2 seconds ago. And this is where our serial presentation really comes into its own, because we're able to compare the ECG with any previous. Before we come on to this, we'll just take a look at zooming in and out. Now, a very quick way to zoom on your ECG is to double click on the area that you want to have a look. I'm just going to change the format that we're looking at here, so I've got a little bit less information in one go. So I can double click and that will give me a 2x zoom. I can double click again and it will zoom out. I can also add my calipers on screen here and extend and contract and add on a march out. It's going to tell me my interval measurements in milliseconds and beats per minute and also which lead I'm measuring in. If I then want to change one of my measurements, I can double click on the top and type it in. It's going to come up in blue until I press enter and then that's saved into it there. Now, if I want to take a look in my serial presentation, I can click on my serial presentation icon in the top right-hand corner. And this will also give me the option for serial comparison where I can compare this ECG to any previous ECG down below. So if I run the serial comparison, it will update this for me on here as well. And then it gives me the option to say, would I like to replace the interpretation with which I've done on here? Now, one of my favorite things with the serial comparison is that it actually gives me the option to zoom in, but also look and pan in tandem on both parts of the ECG. So here I'm looking at V2 and I've got V2 directly beneath it to review that on screen here. Once I'm happy, I can close the serial presentation and it's going to bring me back to my home screen that I'm looking at now. At any point, you're able to go back with home. If I leave here, anytime I leave, if I've made changes, it will prompt me to either save my changes or to leave. And then I can go in and have a look at other tests from the patient. So we were talking about mobile ECGs. I'm going to select one that I know is sinus rhythm and then compare it with a little bit less on screen on here. So I'm selecting an older ECG now, and I'm going to look at this in 12 channels of rhythm because I want to compare it to a 6-lead ECG that's come in as well. This is where I'm going to use my test history and go and view my previous ECG down below. So again, it's a nice way to have a look and compare the two, as well as looking at my current 12 leads ECGs as well. And here I can close that. And if I click sign, we can have a look and then it will sign this ECG as a clinically confirmed one. And then will take me back out onto my patient's tests where I can go in and review the next. We'll there see that it will say confirmed next to it. And if I open it back up, we can then have a look to see how this would be viewed if you were viewing an ECG that had been confirmed by someone. You can see if I clicked my down arrow, it has my name and also a time and date stamp next to it, as well as a signed icon here and a green tick next to it. Any ECG that I've selected from the list as my one I want to view has the pink icon in the corner here, and the first previous will have the grey icon below it. At any time, I also have the option to log out of the system. Again, this can be a time set up to log out, and then it takes me back to the home screen to log back in again. So that's a sort of bit of an overview of the MUSE web client. I'm very happy to take questions if anyone has any.
Thank you very much, Rachel. There are a few questions in the chat, so I can read them out while you may want to show exactly how to do that in that case. So
Okay.
first question, besides doing free text interpretation, can you do copy and paste into the interpretation box?
Oh, that's a good one. I'm not sure. And on my demo tool, I'm a little bit limited, but it's certainly something we can try and find out. Sophia, I don't know if you know the answer to that one.
I don't know by hand. I would need to try as well. So we may need to come back to you on that. But I'm not sure if you have the possibility to try to type some free
I
text
wonder if I
somewhere.
have Notepad on my demo tool and then I can give it a go. I
Yes.
do. Right, let's try it. Oh,
yes, let's
like
try it live.
A question I've not had before. Yes, you can. There we go.
Yes, perfect.
Great question. Thank you very much.
Great. Thank you very much. Next question may be a little bit difficult to answer straight up, but great demonstration. Thanks, Rachel. Could you show us how to export ECGs in different formats, for example, PDF, XML? Is it possible to export ECGs anonymously or under a custom study ID, for example, for research purposes?
So the answer to all of that is yes, but it is quite a lengthy demonstration. So I don't know where the questions has come from. If it's from UK and Ireland, please contact me directly and I can run a short session with you. But we do have a little bit of time, so I am happy to go into the editor client unless we've got loads and loads of questions. I can always run through a little bit of it now.
There's no additional questions, and we do have 15 minutes more of the
Okay,
meeting. So if you would like to show it, that's perfectly fine for us.
absolutely. So
Yes.
there's quite a few different ways you can do it, and it's really going to be slightly variable depending on how much data you want to export. So I'd say that if you're ever thinking you might like to do data export, the easiest way is to try and start it from the very beginning and kind of drip feed your information out into a sort of your data or your research repository. So on my demo tool, if I open my sort of pretend DPR, every ECG I bring in, I export out into a sort of EPR PDF and a sort of pretend research folder. So I drip feed every ECG out into that. And if you have a big system, this is probably the easiest way to do it. If you've got a lot of historic data, depending on the quantity is sort of then going to depend on how you do it, because if you're batch exporting a lot of data, it can slow the system a little bit. So if I just open up my research folder on here, I can show you what the data would look like. So this is coming out in an XML format, which would look like this, and we have the option to include your waveforms or not. So you have a couple of different options on that. If I scroll down, you can see my lead data that comes out here. It doesn't mean a huge amount to me when I look at it, but everyone's been pleased when I've exported it previously, and we can sort of contain all that data with our patient demographics as well. If you export anonymously from the system, it will hide all your relevant patient demographics, but it will link your date of test and your patient date of birth together. So although that will change, it will keep your patient age correct, which means for your interpretation, that then links to your interpretation of that patient. What it does mean is that then tracing back to find out who the patient is can be more challenging. So I'd say the majority of customers that I've worked on with this, they tend to export non-anonymized and then anonymized in their sort of research data folder that they store on their hospital network or wherever they may store that, so that should they find something, they can trace back to who it is. Because when it's totally anonymized in MUSE, it's a bit harder to trace back and find out who the patient is. Then to export the data, if you're doing it as a sort of specific study data, the easiest way to do it is depending on if you're anonymizing or not. So if you're not anonymizing, I'd say the easiest way to do it is a database search, ideally with some sort of reference point within the ECG so you can extract that data. So if you were just wanting all ECGs from a hospital, you would just do it from a date range, and then it's quite easy to export. The other option that I think I showed earlier is we can add on a specific study reference code that you can generate in your statement library. So if I start typing on here, you can see I've sort of made a pretend study reference and I would search on this number code. Or when you're taking the ECG, if I just go back into the web client, you can have a sort of an extra question here, or you might do it via a location ID or something along those lines. So it needs to have a reference that we can search on to pull that data. But if I go back now into my database searches, this will then give me the option, and I have a number of pretend ones that I've simulated in here, and we can get really quite detailed. So what I'd then probably be looking for is I would create a database search based upon this specific code that I want to extract, and then I'd pull the data from there. I'm not going to run through creating a full database search now, but here's one I did earlier. Let me open one of my peds ones because it has a nice amount of data. So this was looking at different pediatric ECG parameter data sets. Again, it's a little bit limited in my test system, but you can see that I'm pulling up my sort of patient demographics and then different QTC intervals, and then sort of diagnosis statements and other options. Now, if I were just pulling for time to export my data, I would maybe have a little bit less information on here. But this is where I can now go to copy my results perhaps into a sort of research database site. So that will take your data into a separate one for research sites, or we can look to then go and extract that in more bulk. But it really is quite variable depending on how much data you want to pull out of the system. Hopefully that covers the answer. If you are someone that's local to me, please reach out and I'll touch base with you offline and we can work together on it.
Thank you so much, Rachel. And yes, they will contact us afterwards. So we are happy to receive your email afterwards. And I think a follow-up question on the previous one with copy paste. A new question on this topic is, can you copy from one ECG interpretation to another ECG interpretation box? And I guess we would need to try this again.
I will need to try it. So
yes.
I will try it in the web client, and if that, and then we can also try it in the thick client as well. So let's give it a go. So I'm just going to open any ECG here and click into the box. Then using a shortcut rather than highlighting it, I'm going to press Control and A to select all. And then I'll just do Control and C for copy, go back out, and then I'm going to go into a totally different test. Again, Control and A to delete, and then Control and V. And yes, you can. And it comes in as free text.
Thank you.
That's okay.
And
that's
the
quite
questions,
nice.
yes,
Two new things.
Perfect. Questions keeps on coming. So the MUSE web displays filter of 150 Hertz is the default. Is it possible to change 100 Hertz to the default value?
I would imagine so, if you're doing that as a sort of global setting. Generally, I would say keep it at 150 because that's when we're going to get the maximum amount of data. And what I really like with the web client is having it on is that it's really obvious to see when we are changing the filter how that actually changes our waveform as well. So you can see as I'm applying it here how the waveform changes. So I think it is. I've never set it to 100 because I always try to leave it at 150. I think if you did that, it would be a global change for everybody using the system. So if it's for a whole site, yes, probably. But if it's just for personal preference, I would probably recommend changing it from below here.
Thank you. And maybe I could add to this one. It could be good for you to understand that the interpretation that is done by 12SL, so on RG healthcare devices, are done on the raw data, meaning the raw data that is sent to MUSE. If you add on a different filter, you may not see the full picture that 12SL has used for the test for the interpretation of the test. Depending on how heavy filtering you do, you may even filter left ventricular hypertrophy for your own eyes, while the 12SL interpretation can state left ventricular hypertrophy due to that's interpreting on raw data.